We have a great conversation on HIV/AIDS prevalence, especially in adolescents. And we know that that age group is rightly affected. And it looks like we're having a trend of increasing cases among ages 15 to 25. We're going to have Dr. Nyonuku Akusia-Badu here. She works with the Ghana Health Service, and they already, we know, have of a national program, the National AIDS Control Program. But look, let's get to town. Let's get to ask young people what they know about HIV and AIDS.
When last did you check for HIV status?
That was last year, December. For the first time that I wanted to check, I was very, very afraid.
If you ever find out that you're HIV positive, what would be your reaction?
Seriously, I wouldn't know what I would do. I don't know.
I've never tested for HIV before in my lifetime.
Have you ever been afraid of testing for HIV?
No, I've not been afraid of testing for HIV. Always, I'm ready to test it, but I've not had time to even go to hospital and check about it. Well, my reaction, if in an event that it happens so, the first thing I have to do, I have to pray to God. I have to leave everything in the hands of God.
That's about 3 months ago because I'm a blood donor. So usually anytime I go to donate blood, I get tested for all those stuff before I carry out the donation.
Are you afraid of testing for HIV?
No. I think there are more, I don't want to use the word dangerous, but more serious diseases than HIV is. But the stigma attached to HIV is what makes people kind of scared about it. For example, hepatitis B, herpes, and the rest are there. Even malaria itself kills more than HIV does, but the stigma that's attached to it is what makes people reproach away from it and are scared of it or scared of getting tested to know whether they have it or not.
Are you afraid of testing for HIV?
No, I'm not afraid.
Are you afraid of testing for HIV? Are you afraid of testing?
Oh no, I'm not, because I tried myself that I don't, mess around myself. So I'm cool and I'm not afraid.
If you ever find out that you're HIV positive, what would be your reaction?
Well, I will be very disappointed of myself, and I don't think that will happen to me, but I'll be very disappointed and it will surprise me. Yeah.
And you all watched them and heard them as well. I guess it's always fear of the unknown, but at least it's also advised that get to know your status, if not once a year, at least once a year, more. That it depends on what you want to know and your sexual lifestyle. But in the meantime, that is also frightening, getting to know that HIV/AIDS prevalence among adolescents and young adults is on the rise. And individuals between the ages of 15 to 25 years, they constitute a great statistic we'll be talking about soon. But let's also preface the whole discussion with some general knowledge on what the general demographic of our population is and what the trends are before we get into some of the great ones. Now, Dr. Nyonuku Akusia-Badu is a public health physician specialist, head of clinical care at the National AIDS Control Program, and we all know that they operate under the Ghana Health Service. Good morning to you, Dr. Nyonuku Akusia-Badu.
Good morning, Roland.
Yeah, good knowing you. But let's start generally before we get to that demographic, the adolescent. What's the general trend?
Actually, amongst the adolescents, we've seen that the number of infections are rising a bit. It's not that significant a rise. However, still any increment is important for us to note. And in 2017, we realized that we had about 20,000 adolescents living with HIV worldwide. And when you look at it by gender, the female adolescents, when we talk about adolescents, we mean 10 to 19 years. Okay. The females are disproportionately affected. So out of the about 19,000 living with HIV worldwide, we have about 12,000 being female. Wow. And about 7,000 being males.
Wow. Wow.
Yes, I know for the adolescent female, we know they have issues with peer pressure, and most of the time we realize that they engage in transactional sex or sex with an older man. And so once they engage in sex with an older man, they are not able to negotiate for safe sex, primarily use of condom. Yes, they are not that empowered to do that.
Wow.
So it goes against them. And you know, once unprotected sex has taken place, you are at risk of HIV infection. And these are part of the reasons why, in addition to substance abuse.
And we know that we're here to comprehensively discuss the general situation, especially among adolescents. But we would also, because we have some of the statistics, trying to take our viewers through what we have. Because we have adolescent HIV statistics currently ongoing. And if we move forward, we'll show you a certain trend of what the pattern has been. That's the total number of adolescents currently living with HIV and what trends have been since 1990. In 1990, we just had around the 5,000 mark, give or take, maybe a little and over or just less of it. And if you look at over a 10-year period, you get to find out between 1999 and 2000, we had the Stop AIDS Life campaign program. And it was also, of course, under the National AIDS Control Program, Ghana Health Service, and the USAID. And then the trend was quite alarming, but consistently over a period, we've seen an incremental numbers of adolescents that get infected. If you look at 2005, we had the numbers in the region just around 14,000 before you get to 15,000. And then we crossed the 15,000 mark just around 2008, 2009. That's quite frightening. And then if you look at where we are currently, this is where we are, and we're getting nearer the 20,000 mark by this period. What should we be worried about? Now, going forward also, we have the number of adolescents living with HIV by gender. And this one, Dr. Nyonuku Badu will be explaining further why we tend to have young adolescents, especially females, getting more infected. By 1990, we had around 4,500, 600 young adolescents living with HIV. And you get to find the brackets, women or young girls between the age of 10 to 19 being the estimated numbers, rising above. And you can get to find that their male counterparts in that same region were quite low. So this is the trend you're having for adolescent males. But for the adolescent females, they kept increasing, and now we have the number by 2017 and over, between the ages of 10 to 19, rising just around 13,000 or 12,000 thereabout. And we'll know some of the specific details. Why do we have this trend? Let's move, also flip on to new infections among adolescents. You get forward and you get to find out by 1990 we had crossed just a little above the 2,000 mark. This one again for young adolescent females. It's a concern for us because by 1999, 2000, we started to drop the trend. But since the year 2010 up to now, we've seen a certain rise, just a little rise, even though we just plateaued up to that point, up to about 2017, 2018, when we had the statistics currently of adolescent females. We'll also get these explanations from Dr. Nyonuku Badu. New infections among adolescents, again, by gender, you get to find. Let's flip on to the next one of the statistics we have. And AIDS-related deaths among adolescents, and again by gender, we'll get to explain to you what the trend has been. Again by females, it's quite alarming. This is where perhaps we'll get to have the explanation. Why is it that by 1990 we had the deaths at this lower range? I believe less than, if not 100, I can see here. But by 2017, 2018, we've seen that the numbers have increased. But Dr. Badu, there should be a reason why. Why are we seeing the incremental numbers, especially of young adolescents who are females, who keep getting infected? You look at what the statistics has been from 1990.
Yes, you know, when we are talking about HIV, we are looking at the prevalence, and so the duration of the disease plays a role there. So over the years, since our first case was reported in March 1986, the numbers have increased. You know, AIDS is spread through unprotected sex or through blood or from mother to child transmission. And you know, our teenagers, some of them got the infection from their mothers. You see, either during pregnancy, during labor and delivery.
So mother to child.
Transmission, yes. And then they've grown, they've been on medication and all that. But when they get to the adolescent years, there's a challenge. Because now, peer pressure, they want to belong, but even amongst their friends, they realize that they have to take medicine all the time. And sometimes it's difficult for them to take the medication because they just want to be part of the group. They don't want anyone asking them questions for fear of stigma, which will make people shun their company because they're HIV positive or not. So they do well, and then when they get to the adolescent years, we really need to support them. Otherwise, they stop taking their medications and then they die. And no, HIV is controlled by the medication, the antiretroviral therapy, ART for short. So once you're on it, you have to stay on it for life and take it as you're supposed to take it.
And I know usually you try to mitigate the trend with some IEC, that's information, education, communication, behavioral trend activities, but also providing the antiretrovirals and the treatment.
Yes.
But have you been able to monitor then the rate that they tend to infect? Especially when they get to adolescent age, once we're talking about transactional sex and them also not wanting to get associated with the stigma that our society usually tend to associate them with.
Yes, you know, as a program, every year we have the HIV Sentinel survey where we have sites that we take samples for testing from pregnant women. That's at antenatal clinic sites, specific sites. And then we also look at our STI clients as well. So from the antenatal sites, we look at the 15 to 19-year-olds. They are one group, and we check the prevalence of HIV there. For 2017, it was about 0.6%. And for the 15 to 24, who are the young women, it was 1.5%. So this is how we are monitoring it. And for now, we have a lot of CSOs. You know, you talk about knowledge about education about HIV, IEC, BCC, that it went low. Yes, that's true, because at a point in time, you know, when the infection started, we did not have medication, and subsequently medication became available, so that became the focus. So a lot of funding went into getting the antiretroviral therapy. But now you see that there's a trend changing, like Joy Prime News is supporting us to do this, to talk about HIV, to sensitize people. JoyNews, sorry.
We have Joy Prime, no, we have JoyNews.
Oh, okay. JoyNews. Thank you for the correction. They're supporting us to talk about HIV, discuss these issues, so people are sensitized to the fact that, yes, indeed, it is still a problem. And you know, the challenge with HIV, we still have the notion of people who are very lanky, very thin, you know, very sick. That's the picture. They are the ones we think have HIV. But really, when you look in the mirror, it could be you.
Is it possible, if I have to then transition to this question, to ask that my time, and looking at how old I am, 40, I associated HIV with those pictures and those images. Yeah. But now perhaps the current generation don't associate HIV with that at all.
Very true.
Okay. If that is the situation, how then do you do the interventions, knowing that these categories of the demographics of the population would find themselves either in school, whether they have the right sort of resources, or on the streets, and so tend to do the interaction? So what do we do?
Okay, so currently the Family Health Division of the Ghana Health Service, together with the National AIDS and STI Control Program, you know, we are working at creating adolescent-friendly corners in the health facilities where they can access sexual and reproductive health care in a comfortable environment where they are not afraid they will see an auntie or an uncle who knows their parents and say that they came for sexual and reproductive health services. These are being scaled up currently in the country. And then for those in school, you know, we want to create, the Family Health Division is working with the Ghana Education Service, where they are creating the opportunity for adolescents to have clubs where they discuss their challenges, and including sexual and reproductive health issues. There's comprehensive sexuality education. It helps them, it empowers them to take decisions about their sexual and reproductive health. And these things are going on in the schools and is being scaled up. Not every school has it, but it's being scaled up.
at the turn of the millennium, when we had that Stop Its Life intervention, there was the emphasis on the ABCs and the condoms, etc.
Yes.
Just not too long ago, maybe the last couple of months, I went to buy condoms, and because I'm married, everybody was watching me with an eye, etc. Is there still that sort of sneak peeking and stigma associated with going to, and does that prevent then teenagers, because they, if you know you can't abstain, then you have to protect yourself?
Yes, you know, it's multifactorial, and culturally, you know, we frown on talking about sex in the open, and you know, for teenagers you would want them to abstain, which is the best actually for them. However, the truth is they are engaging in sex, so we need to empower them to take decisions that I am going to have sex, but I'm going to have protected sex using a condom. And we have the male condom available, the female condom available. But the barrier here is, if they are going to buy a condom from a pharmacy, then it's as if a young girl like you or a young boy like you are thinking about having sex. So there's training going on. The pharmacists who are also being sensitized to offer counseling as they offer the condom sale. They are to counsel as well. Abstinence has always been the best for young ones. And of course, in marriage, you can't talk about abstinence. But before you get married, abstinence is best. If you can't abstain, then by all means, you have protected sex using a condom. And then being faithful to each other. The principles have not changed. The same prevention principles stand. Yes, then the use of the condom. And of course, if you are found to be HIV positive, there is life after HIV.
So for the next 5 minutes, as we try to wind up this conversation, let's try to look at what the statistics are, maybe demographically or regionally, and then whether that has an influence on who should be careful where, etc., or generally is a general precaution. It's
a general precaution. Everyone should be careful everywhere. Once you're going to have sex and it is not with a partner that you know you are both being faithful to each other, you should have protected sex with a condom. And that is the main mode of transmission. 72% of transmission occurs through unprotected sex. And the rest are from mother to child transmission, people who inject drugs, and then sharing of sharps, you know, with someone who is infected with HIV. These are the main modes of transmission. So we would want as much as possible, don't share sharps.
Yes, there are other religions that preclude women from seeing naked bodies, or some people generally also tend to have, so they will not know whether their partner is wearing a condom at the time when and all that. How do you, by way of the communication, tend to demystify some of these?
Yes, so in such cases, you know, when it comes to public health, you look at the message, you look at your audience, and how you are going to give the message across. So where you have a culture where the woman is not supposed to see or touch the male organ, then you see that we have to empower the women to be able to establish that conversation with the husband. They should be empowered to do that, and then, or the partner, and decide to have sex with the person. Unfortunately, most women are dependent, so it's difficult. So it's about female empowerment with education.
Okay, so right now, what should we do? What can be done? We have parents who have adolescents as children, or guardians who have these adolescents around them, community people, and then these adolescents themselves also are living the life, or live life. So where should they go for care? What should they do by way of getting to know their status and all of these?
Okay, when it comes to getting to know their status, you know, the Ghana Health Service has facilities all over, health facilities all over. Private facilities are also offering HIV testing. So anywhere you go, you can walk in and say, I want to have an HIV test. We would love that and would appreciate that, because we don't want people to fall sick before we give them treatment. But if we find out you are HIV positive early, before you have any sign or symptom of the disease, we put you on treatment, and then you stay healthy for life. You can live a long life, up to even 120 years with HIV, once you start your medications and you stay on them. For adolescents, I'll plead with them that apart from the walk-in, you know, some facilities have adolescent health corners. You know, I talked about the Family Health Division of the Ghana Health Service doing this together with the Ghana Education Service. And for parents, we are the first point of contact for adolescents. They should hear about sex, protective sex from us. Because when we don't talk about it, we behave like the ostrich sticking its head in the ground when there's trouble coming. And they will go and get wrong information from their colleagues. It is difficult. It is not easy. I have 2 daughters. One is an adolescent. The other isn't. But I've talked to them about sex according to their level of understanding. And I've educated them about protection as well. And I've also told them about the fact that it is important to abstain until you get married. So it can be done.
Okay, I only have a minute, but I have 2 questions. I'm wondering, one is from a friend of mine who lives in Liberia, Raindorf Haligan. And Raindorf, good morning, and thank you for watching. Please ask her, is it true that during unprotected sex you get infected when one partner has a cat, or is just through unprotected sex generally?
Okay, so through both ways. Once you're having unprotected sex with or without a cat, especially for the females, you realize that the semen can stay in the genital tract for up to 3 days. So if the person is HIV infected, the man is HIV infected, you have room for a lot of time for the transmission to take place. And the reverse for the men. If the semen gets out
quickly?
No, once there has been deposition, there's still transmission. It occurs. Yes, and for the males, usually, no matter what, there's still, you know, there's a little friction, so you still have some minor abrasions through which the transmission can occur. It may not be painful, but it has occurred once there's rubbing, and then the transmission easily occurs.
Raindorf Haligan, friction will give you some abrasions. Be careful. But we're having a growing trend of gays or homosexuals or lesbians, especially in our country, and many young adults, if not adolescents, are also involved. Are you taking care of that group, or how are you taking care of them?
Yes, we are taking care of them. You know, the National AIDS Control Program works with the CSOs like WAPCAS, that's the West African Program to Combat AIDS and STIs, and other subgroups, ProLink, CPEG, and etc. They actually target the MSMs, the men who have sex with men, and the female sex workers, commercial sex workers, and they are bringing them on board, encouraging the use of condoms and lubricants, especially for the MSMs, which is very important.
MSM is?
Men who have sex with men.
Men who are MSM?
Yes, men who have sex with men. They should use condoms and lubricants. That reduces the friction and all that.
The cuts.
Once it's well lubricated, they don't get cuts, the abrasions, and then they are protected as well.
Okay. I don't know whether you have a message. I would want you to look into the camera and have a nice message of advice.
Yes, I have a message. Please get tested for HIV. Get to know your status early. It's better than waiting till you are very ill and then everyone gets to know you have HIV. And once you are tested positive, there is life. There's medication, antiretroviral therapy, from babyhood to the oldest person. There is medication. So get tested, and if you're positive, get on treatment and stay on treatment for life. Thank you.
Oh, that's a beautiful message. But I'm getting more of my friends also watching, and so I would want to ask more questions. And this one is coming from Patrick Osei. He's giving me this message from Kumasi, a good friend of mine.
Okay.
And he says that he got tested last year, does it every year, but this year has not tested. But he's married, has had some relationships with 2 others over the last 4 or 5 months or so.
Yes.
He says November is when.
Yeah.
And would he need to go get tested?
Yes. He has had unprotected sex, or even if you use the condom, it's good to know your status, because sometimes the condom breaks and other things when we don't use it well. So it's important. I would encourage him to get tested, but I should try to stay away from unprotected sex.
Kofi wants to know, it looks like your panelist is only focusing on adolescents. What's the situation with adults?
Good question. I wasn't given the opportunity to talk about adults. You know, it's estimated that for 2018, we had about 316,000 people living with HIV, out of which adults were about 290,000. The rest were children, yes. And for the new infections, we had about 17,000 new infections last year, out of which children were just about 2,564, yes. And for the deaths, we had about 12,000 HIV deaths, HIV-related deaths in Ghana last year, and out of which children were just about 2,473. When we talk about children here, according to UNAIDS, it's those who are 0 to 14 years. So yes, amongst the adults, we have about 290,000, out of which just a little over 100,000, about 113,000 are currently on treatment. So we want everyone to test and get on board because there's medication.
Yes. But we're having an increasing trend of married men who are infecting their wives, and is it because they are not getting the education is still not prompting people, or they think?
Oh, actually, you know, for the married men, we encourage them to go for antenatal care with their wives, where they will both get tested, because most of our testing is among pregnant women. But incidentally, their prevalence is low. We had 51% of all the 1.7 million tests we did being pregnant women, out of which only 1.6% were positive. But for the men, just about 330,000 tested, but 6% were positive. You see, so we want people to get tested. And couple testing is much encouraged in our facilities so that people get to know their status. So when we talk about the prevalence, amongst the pregnant women, it was 2.4% in 2017. In 2018, it was 2.1%. Sorry, 2016 was 2.4%. 2017, 2.1%. So it had gone down from 2.4 to 2.1. So you realize that actually there's a decreasing trend amongst the adults. So our pregnant women are getting tested. Their partners should also get tested.
Thank you. I've enjoyed the conversation. Very educative. And I hope that all of you also have been educated as well. We all need to be each other's keeper. And I hope that you're going to get to that voluntary counseling and testing center and get tested. Don't be afraid. Make sure that you're taking the right sort of education and psychological makeup they'll give you before you get tested. It's good to know your status, and also be careful out there. Well, we've had some great interaction with Dr. Nyonuku Akusia-Badu, who is a senior public health physician specialist and the head of clinical care at the National AIDS STI Control Program. There's one question I didn't ask, so it's about the other opportunistic STI infections. Yeah, I couldn't ask that one, but we don't have the time. And thank you very much. We have to bring you into the studio, and perhaps maybe in an outside setting we can do some better education as well. Education is always good.